Good afternoon, everyone. I'm Valerie Wolf. I'm the Executive Director of the Hamilton Clinic of OCAL, the Occupational Health Clinics for Ontario Workers, and I'm very, very pleased to welcome you today for what I think is a really important dialogue and opportunity to learn about on this day of mourning. This is our second time offering a webinar on the day of mourning, which I think is quite important to continue marking. It is actually the 36th day of mourning, and this afternoon we're going to look at injuries and death initially through the lens of the study about 9 international agricultural worker deaths, and then also more broadly from the perspective of the Coroner's Office and the Ministry of Labour, Training and Skills Development, and so that we can all learn everyone's role, and then most importantly, how we can learn by the study of these deaths to prevent them in future. And I did want to mention that this issue struck home this week when Steve, the 36-year-old friend and former roommate of our ergonomist in Hamilton, Daryl Stevenson, was fatally injured at work in a Hamilton steel plant on Tuesday. And according to the CBC report, the company was fined $150,000 in 2018 for a worker death from 2 years previous. Fatalities shouldn't happen, especially twice in one workplace. Hence the reason for the day of mourning, which coincidentally is the same age as Steve, 36 this year, as well as today's event. How can we learn from past deaths to prevent future ones? Before we begin, I would like to read OCAL's statement marking the day of mourning and also have everyone stand for a moment of silence to reflect, remember, and gather strength together to continue to fight for the living in every way we can. So, on this day of mourning, the Occupational Health Clinics for Ontario Workers honor the workers who have suffered from occupational disease, injury, and death due to the workplace. We pay special homage to those who served others throughout these unprecedented times amidst a global pandemic and suffered immeasurable loss. Occupational disease fatalities have outnumbered traumatic fatalities in each of the past 10 years, and many more work-related illnesses and deaths go unrecognized and unreported. This year's theme, Work Shouldn't Hurt, reminds us to continue protecting workers through prevention and empowering workers, their families, and communities to arrive healthy, work healthy, and especially go home healthy and safe to their families. Thanks. I don't know how many of you can join me in standing up, but I am going to stand up and as I said, have a minute of silence. Even though a minute seems long right now, a minute's not a long time when you think about somebody not coming home. Thanks. Just switch. Sorry, had to switch my computer. And so now I'm going to turn it over to Michelle. As you know, we have 3 segments to the afternoon. We're going to learn about the key findings and recommendations from the study of the coroner's files of migrant agricultural workers' death in Ontario from January 2020 to June 2021. Then we're going to hear from the Ontario Office of the Chief Coroner about their role and general response to worker deaths, as well as the review that they did last year. And then we're going to hear several voices from the Ministry of Labor Training and Skills Development about their roles, their response to deaths and to the coroner's inquests and to vulnerability protection initiatives that they're working on, and as well how the results of these processes are translated by prevention into ongoing programming. And then we'll have an opportunity at the end for us all to discuss it. So I'm going to turn it over right now to Michelle Tu, our occupational health nurse from the Hamilton Clinic, to lead us through the first segment. Thanks very much.
Good afternoon, everyone, and thank you for joining this event. As Val has already mentioned and alluded to, that this webinar seeks to expand our knowledge of the roles, contribution, as well as limitations related to investigating worker deaths through the experience of investigating migrant farm worker deaths during the pandemic. Ultimately, the objective is to foster understanding and a common purpose to learn and apply this knowledge to prevent future illness, injuries, and deaths. This is particularly poignant on this day and moving forward, given that 2022 has seen further migrant agriculture worker deaths, with at least one worker dying alone in quarantine in a foreign country who asked him to come here to work. During the session, specific worker case details will not be discussed due to confidentiality. And we have a fairly busy agenda, as you already see, and Val has mentioned. And so after each segment, there will be a few questions, time for a few questions after each segment. But the majority or further questions will be asked at the end of the whole session. So this first segment, as Val has mentioned, focuses on the key findings from a study of the coroner's files of migrant agricultural worker deaths in Ontario from January 2020 to June 2021. This study was conducted by members of the Migrant Worker Health Expert Working Group, who I will introduce. The expert working group was formed in April 2020 to address the needs of migrant agricultural workers in Canada during the COVID-19 pandemic. The expert working group includes participation from academic and medical experts, as well as clinical and social service leaders, representing decades and decades of research and related experience with this population. This group provides support, advises, and provides evidence-based guidance to both federal and provincial governments to assist with the establishment of adequate national standards, regulations, and practices to ensure the health and safety of all migrant agricultural workers. For this first segment, I'm joined by Stephanie Mayel, PhD candidate and expert in migrant agricultural workers and mental health, Dr. Max Tran, resident in public health and preventative medicine, who led the medical review portion of this project, and Dr. Susanna K. Huck, assistant professor of the School of Nursing at Western and also an affiliate professor at UBC Okanagan, as well as co-founder of the expert working group. And Susanna was a principal investigator of this project, and she will provide a summary of the report by video. Just as a background to this specific project, the Deputy Chief Coroner, as many of you know or may not know, conducted a review of the first 3 deaths of migrant agricultural workers from COVID-19 in 2020. To clarify, this was not an inquest. This was a review. In the 55 years of the migrant worker program in Canada, there has never been an inquest into a migrant agricultural worker death, even though there have been many, many deaths under many, many different circumstances. This review, the results of which were published in October 2021, included 35 recommendations for federal, provincial, and specific ministries and agencies, and was consulted and referenced in further work related to migrant agricultural workers. It was an important document, an important report. A number of members of the expert working group participated in this review, and I have to say for us, it was a very positive experience, and the first experience, I have to say, working with the Chief Coroner's Office. And a lot was learned, particularly about the value of the Coroner's Office. And in early 2021, workers continued to die And there were certainly several of the workers died in quarantine. Some tested positive for COVID, some very shortly after arriving. And they were, and I guess the working group was alarmed, and we were concerned that there may be systemic factors that are contributing to these workers' deaths. They were young to middle-aged, as I said, at different phases in their arrival and their work in Ontario. And but I think the main feature was they were from different geographical areas in the province. And so they were basically all from unique jurisdictions within the province. And so there seemed to be, or there was not at that time, a systematic review or investigation as to what was leading to these workers' deaths. And we were very concerned that it may have had something to do with travel or vaccine or quarantine or whatever, and just really felt that there needed to be action and it needed to be urgent. So we bounced around a few different contacts to see how we could get any traction on this. And we ended up turning back to the coroner's office to Ruben and Julia Mann for guidance and for assistance in terms of how to investigate this problem, this current, and what we felt was specifically an urgent or an emergency type of an issue. So the research project that's reported here is a result of that consultation. And Susanna, who is on holiday, good for her, well needed, has done a video to review the report and the process of that project.
Hello, and thank you for the opportunity to share research findings from a review of coroner's files of migrant workers' deaths in Ontario. My name is Dr. Susanna Kashach, and I'm a nurse researcher and faculty member in the School of Nursing at Western University. I was the principal investigator of this study, but this project was carried out by an interdisciplinary team, including nurses, doctors, and other migrant worker health experts. Our work was supported by the Migrant Worker Health Expert Working Group and the Deputy Chief Coroner's Office of Ontario. Funding for this project was provided through a fellowship in health equity that I hold through the Arthur Labatt Family School of Nursing. 1 in 5 agricultural workers in Canada are temporary foreign workers. Deemed essential at the very start of the COVID-19 pandemic, the importance of this group for Canada's food supply has been well recognized. Yet the limited and partial protections and services afforded to this population do not reflect the same valuing. Decades of research show that migrant agricultural workers are uniquely disadvantaged in accessing timely and appropriate health care. And because of their temporary status and the terms of their work permits, they often find themselves unable to refuse unsafe work or report unsafe or hazardous issues they face in the workplace. These men and women are typically housed in isolating and crowded accommodations on employers' property, limiting their ability to be aware of and connected to resources and supports off of the farm. This group has also been disproportionately impacted by COVID-19. They have faced significantly higher infection rates than most other occupational sectors. And in January of this year alone, at least 3 migrant agricultural workers have died within their initial quarantine period. We were therefore motivated to carry out this work to identify key factors and points of action to prevent the deaths of migrant agricultural workers. Our research team had 3 key research questions summarized here. In full, these questions were: what was the medical trajectory of the migrant agricultural workers who died in Ontario? What common medical issues or factors exist across records of migrant agricultural workers who died during this period that may have contributed to their deaths? And point 2, what psychosocial, demographic, economic, and environmental conditions were experienced by these individuals? How can these conditions and/or demographics help us understand the circumstances that led to the death of these individuals? And 3, how can these findings support points of intervention and prevention that may decrease the risk of death and serious illness or impairment among migrant agricultural workers. Our team reviewed identified cases of death in Ontario among the migrant agricultural worker population from January 2020 to June of 2021 for a total of 9 individuals' deaths. We employed a qualitative descriptive methodology, a research approach that guides the researcher to stick close to the original data text. Each file was reviewed by a minimum of 2 readers, with longer or more complex files being reviewed by 3 research team members. An extraction tool was developed to elicit concrete information, such as access to translation or type of medical check-ins provided. Open-ended as well as structured options were used to manage relevant information, while providing opportunities for reviewers to document information that had not been identified a priori by the research team. And through application of the socio-ecological lens, our research team conducted analysis considering the broader social determinants and factors that could help to explain the health outcomes of each individual. Our findings were categorized under four key domains identified here. Individuals' ages ranged from 25 to 57, with the majority having no previous medical issues. Several conditions related to recruitment and travel made it more difficult for workers to stay safe and heightened the risk of exposure to COVID-19. For instance, in one case, an individual's employment was misrepresented through the recruitment process, leading to him and his coworkers being undocumented in the country. Several coworkers described incurring debt, which made workers even more hesitant to report crowded housing conditions and inadequate workplace standards. Multiple routes of exposure to COVID-19 were introduced by the different methods of travel that workers had to take to get to their work site in Canada. Once in Canada, shared vehicle transportation to post-arrival quarantine sites or workplaces could introduce further risk. Several workers tested positive for COVID-19 soon after arriving in Canada, despite testing negative upon arrival, suggesting that they had become infected either during their initial quarantine or during their travel to these quarters. Inconsistencies in terms of monitoring, quarantine conditions, and isolation were frequent, suggesting significant lapses in oversight and standard protocols. Several individuals' health status declined rapidly, and consequently, they did not survive long enough to make it to the hospital for treatment. One of the factors shaping the conditions of healthcare monitoring was individuals' poor quality and precarious housing. Initial quarantine accommodations were typically shared, with one worker sharing his living space with 5 other co-workers. Housing was often described as crowded, unsanitary, and without the necessary conditions in place to allow workers to safely distance. While workers were observing initial quarantine or additional isolation periods, they often depended on employers rather than healthcare professionals to check in on them. In one case, an individual's health deteriorated very rapidly despite reported daily check-ins by a farm employee through a motel room door. In another case, an employer appeared to have tried to manage a worker's symptoms through the provision of over-the-counter medications. Of particular concern, public health units delegated monitoring of symptoms to employers sometimes because employers reported speaking Spanish, the same language spoken by some workers. Several barriers to accessing and navigating healthcare were identified through a review of the files. In some cases, as a result of limited knowledge of the healthcare system and limited resources to speak directly to a healthcare professional, emergency medical treatment was delayed. In one case, an ambulance was dispatched to the wrong location, delaying medical treatment for over 40 minutes. Lack of familiarity with the healthcare system and limited support with translation and interpretation also proved to be a significant barrier. In one case, an individual with a severe case of COVID-19 pneumonia initially declined a life-saving intervention due to a misunderstanding that he would have to pay for it. As the files were not comprehensive, many questions were raised that we were not able to fully address through our study. For instance, with more contact tracing information, we may have been better able to determine the sources of viral transmission for some individuals. Furthermore, no mention was made of resources, supports, or referrals offered to these workers. Of particular concern, it was not evident that any protocols were in place to either investigate the deaths of these workers as work-related or to ensure that the families of these individuals had access and support to compensation from the Workplace Compensation Board. Some Ministry of Labor correspondence available in the files indicated that investigations would not be conducted as they were seen outside of the mandate of the ministry, given that the individual had not reported to the worksite. Our review of the coroner's files related to the death of these 9 migrant agricultural workers from 2020 to 2021 suggests that these deaths were largely preventable. This speaks to the urgency of acting now to prevent future deaths of the men and women who put food on our tables. Measures to mitigate airborne transmission through all forms of travel must be rigorously enforced. All individuals' travel should be provided with N95, KE95 masks or the equivalent, with clear instructions on use. Business as usual practices with this population of relying on an employer to serve as an intermediary or translator or in lieu of medical professional clearly are not in the best interest of migrant agricultural workers. Therefore, accessible, independent testing and monitoring by healthcare professionals must be the standard when working with this disadvantaged group. Clearer two-way communication between migrant workers and clinicians can promote early detection of COVID-19 and inform more robust and proactive prevention measures to reduce the risk faced by this population. Prior research makes evident that migrant agricultural workers face significant barriers accessing health services. Furthermore, they have limited faith that clinicians will provide them with quality care. Health care professionals must work closely with support organizations who have a strong track record of providing culturally and linguistically appropriate services to this group. These individuals must have a strong understanding of how to access emergency care and primary care services. Barriers to care, such as interpreters and concerns about financial costs, must be anticipated and addressed proactively. Training of frontline care providers, as well as dedicated teams equipped to develop accessible and holistic approaches to working with this population, could help address gaps in access and care often faced by this group. Researchers and advocates alike have long pointed to the limited accountability in place to address unethical recruitment of migrant workers. The duties of agencies and recruiters under the Ontario Occupational Health and Safety or Labour Relations Acts must be clearly defined towards addressing the misconduct of exploitative actors. Since regardless of whether workers come under a formal or informal program, most experience strong pressures to underreport violations and harsh consequences if they do refuse or report unsafe work. More proactive inspections and accessible mechanisms to report mistreatment without reprisal must be in place. The COVID-19 context has also made evident the significant health risks that are faced by workers as a result of poor and inadequate housing, isolation, limited mobility, and access to services. Now is the time to establish national housing standards as well as safe and independent modes of transportation for workers that safeguard their health, well-being, and dignity. Interjurisdictional coordination is needed to ensure that investigations in the case of a migrant worker's death are sufficiently comprehensive and pinpoint actionable steps for prevention. Towards this end, clear and inclusive parameters for a death investigation that demonstrate awareness that this population arrives in Canada solely to work must be the norm for the Ministry of Labour and partnering agencies. Furthermore, coroners, clinicians, and others involved in death reporting should apply a context-sensitive framework, such as the social determinants of health, to ensure that unique conditions of this group are fully documented in understanding the factors that contributed to an individual's death. The fact that in most cases, no evidence that a next of kin had been informed about their eligibility for compensation and bereavement after the death of their loved ones does raise some concern that a clear protocol is lacking to ensure that families are being supported. More broadly speaking, the root of many of the challenges faced by workers is related to their status as temporary workers whose employment is contingent on a working relationship with a particular employer, creating conditions where workers have more freedom in the sector and more explicit protections under the law requires continued advocacy for open work permits and permanent residence as important mechanisms to protect workers' health. In conclusion, workers incur the risk and none of the protections of their designation as essential workers in Canada. This risk is experienced from the beginning of their journey traveling to Canada. This research found that health responses by public health agencies normalized a reliance on this group's employer as intermediary. This contributed to the fatal outcomes faced by this group. Long established barriers such as lack of transportation to access medical services, lack of interpreters, limited familiarity with the healthcare system have remained largely unaddressed despite decades of research documenting these challenges. Within the COVID-19 context, these barriers were worsened, leading to heartbreakingly tragic yet predictable consequences. The silver lining and the heartbreak of this research are one and the same. These deaths were largely preventable. Preventable deaths require proactive solutions. Now is the time to act, to let the deaths of these individuals never be forgotten, but never be repeated. Thank you for the opportunity to share some of these research findings with you today. I look forward to hearing more about the conversation, and thank you to my research team members who are there to take questions.
Say in absentia, thank you, Susanna, for that presentation. Does anyone have any questions at this point in time? I don't see any questions in the chat, but if you do have a question, you just want to put your hand up, then would be happy to entertain it. I don't see any, unless I'm missing hands. Steph or Max, did you want to add anything at this point in time?
I think Susanna covered the general key findings that we have. And I think the most important takeaway is that it really comes down to the structural vulnerabilities that migrant agricultural workers live and labor under here in Ontario that place them at risk to the social determinants of poor health that we figure very largely in many of these deaths. And so we appreciate the opportunity to be here today and share these findings with you. And if there are any questions that emerge, we will be here near the end as well to take any questions. Max, do you have anything that you'd like to add?
I think I just wanted to echo one of Susanna's comments towards the end of that video about the nature of many of these deaths being very preventable. I think that's a big finding that stuck out to me in the process of reviewing these charts. And as Steph mentioned, it really does come down to the structural vulnerabilities that these workers find themselves facing. So yeah, very sobering to be part of this process. And hopefully, I encourage everyone to read the report that our group came out with and the recommendations around that. And we're happy to take any questions that anyone might have.
Thanks, Stefan and Max. And thank you very much to the coroner's office for both suggesting the research study and also enabling us to be able to have access to the files and that information. So I want to send them a big thank you for that. The hope and the plan was to be able to look at all of these deaths in a systematic manner, something more coordinated, so that there could be recommendations to the provincial governments, to local governments, to local agencies in terms of how to prevent these deaths in the future. And we haven't really had an opportunity to have further discussion and follow up with some of the agencies that were definitely mentioned within our report. We have had some discussions with some of the agencies, but it can go a lot further. And I think the other message from the expert working group is that we strongly would support inquests into migrant agricultural workers' deaths.
Bill has a question.
Okay.
Yeah, thank you. So Bill Roy, I'm actually going to be speaking later. I'm from the prevention office at the Ministry of Labor, Training, Skills Development. Thank you for the presentation. Absolutely. I think one of the things that I certainly agree with is having the multiple levels of government or of regulation makes it extremely difficult. I think that we've learned a lot through COVID on how to work more effectively as federal, provincial, and the municipal and with the local public health offices. Is there some sense that an inquest for workers working in agriculture will help to try and resolve some of those issues, or are you hoping that we will proactively do some work here? And I guess this report, it's not necessarily an inquest, which is something that we typically deal with as far as recommendations. So I'm just curious where this report has been directed internally here, and because I certainly would love to work on it and respond to it.
Jill, did you want to?
Yeah. Okay. I'll start and Steph can finish.
Sure.
We're a good team at that. So thanks, Bill, for the question. I was hoping that that you folks could let us know where the report has gone internally, because we have not had an opportunity to discuss it in a broader framework. We certainly have had some good suggestions. And those will be probably addressed today. And then I'm also hoping that Reuven can perhaps clarify what the reach and what the scope of an inquest could accomplish that this review and research project was not able to do at this point in time. Steph, did you want to add something there?
I was very much going to say a similar response. However, I would say that our recommendations do detail some opportunities for prevention. And one of the things I think that can be particularly concerning in this context is sort of the blurry lines around what a work site is. And in the context of workers arriving into a quarantine facility, and then being later deemed not yet having started work and having passed away during this quarantine, but they're here for work, living in an employer governed and provided accommodation. And so I think that some of these jurisdictional gaps and just the general unique nature of being a temporary foreign worker who is living and working in his employer's area creates potential and definite challenges for this.
Mm-hmm.
Yeah, thank you very much. Absolutely great point. And and I know that we've got John and Ileana, I think is on as well from LTSD. So it's important for us to hear, and I think that forums such as this one allow us to not only hear from you, but also hopefully, I see Carlos stand up, hopefully from those that are listening, because that's why we're here as well, is to hear from you and your thoughts and experiences. So thank you for your response.
That's great, Bill. And as you said, John is going to speak to some of those issues later. And someone else had their hand up?
Carlos.
Hi, good afternoon. First of all, thank you very much for organizing the conference. My name is Carlos. I am with Conseil Migrant. We are based in Montreal. And well, the case of the first 3 agricultural workers that died on 2020 with the COVID touches, we got requests from the family to find out what was going on the farm. So we got in contact with the coroner's office and the consulates. The question that I was going to ask you is, have you considered the interaction with the governments of origin, the Mexican, the Guatemalan? I think that it will be great if they are involved in these efforts. At that time, it was striking. I mean, it was really shocking that we had to teach the coroners about if the people deceased were nationals from Guatemala or Mexico, they were supposed to let the consulates know, and they didn't know that. So it would be great if you guys can incorporate that to the municipal, provincial, and federal government, also the governments of origin.
Thanks for that,
Thank you.
Carlos. Steph, did you want to just comment on that?
Yes, so we did share the coroner's report with sending country representatives who send workers to the SOP. I've not had a continued conversation with them to that end, but if there are particular points that emerge in our discussion today, it may be a good point to follow up with some of the consular and liaison officials. So thank you for that suggestion.
Okay, as you said, we'll have time for more questions later on. So if they come to you and you want to type them in the chat, then that would be great. Or we'll see if we have time to take them, I guess, live at the end of all of the presentations.